Welcome to the Medical Conditions and Procedures channel. This channel's goal is to educate, enlighten, and assist people to make informed decisions about their health. In this video, I explain what is diabetes. Don't forget to hit the subscribe button and turn on the notification bell, so you never miss any of our upcoming videos. Diabetes is a chronic medical condition which results in high blood sugar levels. It is also known as hyperglycemia. Diabetes happens either because the body doesn't produce enough insulin, a hormone that regulates blood sugar, or because the cells do not respond properly to the insulin that is produced. As a result, glucose, also known as sugar, builds up in the blood, instead of being used by the cells for energy. There are two main types of diabetes. Type 1 diabetes. The body's immune system mistakenly attacks and destroys the insulin-producing cells in the pancreas. Type 2 diabetes. This is the most common form of diabetes and occurs when the body becomes resistant to the effects of insulin or does not produce enough insulin to meet the body's needs. There is also gestational diabetes. This type of diabetes develops during pregnancy in some women who have not previously had diabetes. I'll discuss this type of diabetes in another video. Here are the common risk factors associated with diabetes. Family history. Being overweight or obese. Excess weight, especially around the abdomen, can make cells more resistant to insulin. Lack of regular physical activity can contribute to obesity and insulin resistance, increasing the risk of type 2 diabetes. A diet high in processed foods, sugary beverages, and unhealthy fats can increase the risk of type 2 diabetes. The risk of type 2 diabetes increases with age, especially after the age of 45. Women with polycystic ovary syndrome are at increased risk of developing insulin resistance and type 2 diabetes. High blood pressure or hypertension can increase the risk of type 2 diabetes. High cholesterol levels can increase the risk of type 2 diabetes. Some ethnic groups, such as Africans, Asians, Hispanic, Latinos, and Native Americans, have a higher risk of developing type 2 diabetes. If you have a history of heart disease or have had a heart attack, you may be at increased risk of type 2 diabetes. The symptoms of diabetes can include excessive thirst, frequent urination, unexplained weight loss, increased hunger, fatigue, and blurred vision. The diagnosis of diabetes involves several tests and criteria to determine whether a person has the condition and what type of diabetes they may have. The most common tests used for diagnosing diabetes include urine tests for sugar, but this is not the definitive test for diagnosing diabetes. Fasting plasma glucose test. This test measures your blood sugar level after fasting for at least 8 hours. A result of 126 mg per deciliter or higher on 2 separate occasions typically indicates diabetes. Oral glucose tolerance test. For this test, you fast overnight, and then your blood sugar is measured after drinking a sugary solution. A blood sugar level of 200 mg per deciliter or higher, 2 hours after the drink, indicates diabetes. Hemoglobin A1c, HbA1c, test. This test provides an average of your blood sugar levels over the past 2 to 3 months. An HbA1c level of 6.5% or higher is considered diagnostic of diabetes. If left uncontrolled, diabetes can lead to serious complications, such as heart disease, stroke, kidney damage, amputation of the fingers, toes or legs, and eye problems, including blindness. The treatment of diabetes aims to manage blood sugar levels and prevent complications. The specific treatment approach depends on the type of diabetes, type 1, type 2, or gestational, and individual factors, such as age, overall health, and lifestyle. Here are the common treatment methods for each type of diabetes. Type 1 diabetes treatment. Insulin therapy. This involves regular insulin injections using syringes, insulin pens, or insulin pumps. The dose and frequency of insulin depend on factors like diet, physical activity, and blood sugar levels. Regular blood sugar monitoring is crucial for adjusting insulin doses and maintaining stable blood sugar levels. A balanced diet, with an emphasis on carbohydrates counting and portion control, helps regulate blood sugar levels and prevent complications. Regular exercise can improve insulin sensitivity and overall health. It is essential to coordinate physical activity with insulin and food intake to avoid fluctuations in blood sugar levels. Type 2 diabetes treatment include lifestyle modifications play a central role in managing type 2 diabetes. This includes adopting a healthy diet, increasing physical activity, and achieving and maintaining a healthy weight. Several oral medicines are available to lower blood sugar levels and improve insulin sensitivity. If lifestyle changes and oral medicines are not enough to manage blood sugar levels, insulin therapy may be added to the treatment. Regardless of the type of diabetes, the following measures are important for effective diabetes management. Regular medical checkups. Regular home blood testing. Education and self-care. This includes understanding how to monitor blood sugar levels, administer insulin, and recognize signs of high or low blood sugar. People with diabetes should take care of their feet and promptly address any foot-related issues to prevent complications. Since diabetes increases the risk of heart disease, it is crucial to manage other cardiovascular risk factors, such as high blood pressure and high cholesterol levels. Looking after your emotional and mental well-being. Diabetes management is a lifelong commitment, and it requires active participation from individuals with diabetes along with the support of healthcare professionals and a strong support system. Effective management can help prevent or delay complications and lead to a better quality of life for those living with diabetes. Thanks for watching. If you would like a medical condition or procedure explained, post in the comments below.